hold. How you will hold? Hold closing the glottis. Can anyone try for that? Closing the glottis. Then the air will be inside the lungs or abdomen. That is what the inspiratory hold. That inspiratory hold will again help you to get a maximum expiration. Maximum expiration. Understood? This looks very simple, but this will help definitely the patient with having dysarthria problem to get better speech. Understood? Next, blowing balloons. What is the use of blowing balloons? Why? To improve what? Whether to improve the inspiration or expiration? Expiration. Feathers. Feather will be very, lighter thing when you need maximum expression, effort, okay, to move the feather. Then cotton balls, blow through a straw. Okay, blow through a straw. That all will help you to improve and your expression. Next is treatment for phonatory. Same again here, postural adjustments for phonation. Okay, again you need to adjust for postural adjustment, then controlling vocal folds to enhance the naturalness of speech. So like how you are closing the glottis, same way you want to try to close the vocal cords and relax the vocal cords. Okay, you know how to do that? Glottis, can anyone? Now while swallowing, okay, try to close it. You need to practice for that. Okay, if you practice, if you feel that, then you can ask the patient to do that. Otherwise, you can't ask the patient to do that. Understood? As if you are filling the air inside your lungs. Like that. So that will help you to get a better phonation, controlling the vocal cords. Okay. Next, improvement of strength and control of velopharyngeal port by practicing nasal versus oral airflow pattern. This is nasal, okay, then oral airflow patterns. Means here taking the air, then taking the air orally, then leaving with nasal. So this will help you to improve the oral nasal pattern. Okay, very simple exercise, but it is very important for the patient to improve the dysarthria. Next, next is for treatment for articulation, articulating the word. So what is the first one? Focus the patient's attention to the accuracy, range and direction of movement during speech. So while speaking, you want to see the direction, range. Some of the patient, let it be if it is an Bell's palsy, they will speak like that. Everything will go like this, without closing of mouth and all. Okay, even hemiplegic patients, they will talk like that. Everything will go like that. So you want to check for the range, direction, okay, and what you have to do, you want to try to adjust that and try to get that muscles strength. Okay. Next, feedback from the clinician can include articulatory placement cues. So how you will give an cues? Either you can give some mirror so that they can adjust their mouth deviation or any other range of motion and all. Otherwise, patient, the clinician, the physiotherapist has to give a feedback. Close your mouth properly, move your mouth to the right side. Like that you have to give some feedback. This is in regards to articulation. Problem in the range of the mouth, jaw. Okay. So that is about accuracy of range and direction of movement during speech. That is one more. Next, we are giving and feedback. What else you can do for facilitation technique? Facilitation technique, you can do brushing. upper and lower lips. So that will give some stimulation effect which will facilitate the person. So most of the people with a stroke or Parkinson's disease or some other problem, they don't have a movement of lips. So to facilitate the lips, have a brushing, or you can use fast icing. This can be done. You can do in hospitals, no problem. Take the ice cube, just have a fast icing. So that will definitely facilitate the persons to use their lips. They are like this, opening. So what you have to do? Quick icing. What is that? Quick icing will facilitate the lip movement. Understood? Or you can use brushing. Okay. So that is about the facilitating. Even you can use ice with the different flavors. What are the different flavors? Generally, ice cream, what are the different flavors? Vanilla, orange, mango, so many flavors. That will also facilitate the people. This is not no, jokes and all. This is very important because most of the people, if they can't communicate, they will get frustration. This frustration may again lead to some more stroke. Understood? So if you do all these things, definitely they can be able to communicate. So you can prevent the further chances of having again reoccurrence of stroke. Understood? They can be little motivated, or they can be little happy if they can communicate with speech. Physiotherapist, major part is of speech therapist. But when you are doing your physiotherapy, your main thing is posture. What is the important thing of physiotherapy? Speech therapists, they never think about the posture. But as you are a physiotherapist, make them to get a good posture so that they can have a better inspiration and expression. And you can facilitate the muscles over here. That's in physiotherapy part. So try to facilitate the muscles so that they can articulate the word. Understood? Next. If it is an spastic, you need to give some stretching exercise. Stretching exercise where you want to wear the gloves, where you want to wear some gloves. Spastic means what? Very tight. So the first muscle what you have to stretch here is tongue. So take the tip of the tongue, try to stretch into all directions. Without tongue, can you be able to speak? No. If tongue is too tight, you can't speak. Definitely in people who are having prolonged bed rest and all, the tongue will get retracted. It will go down, retracted. So what you have to do here is, you try to take the tip of the tongue and try to stretch onto the all means two directions, onto the other directions. So that is what clearly given. Pull the left or right and hold each position for 10 seconds. 1, 2, 3, 4. You can count and hold it for 10 seconds. What is the next one? Lip stretchings. Similarly, you have to stretch the lips also. Upper and lower lips. So that you will get some mobility. Next is what? Jaw stretching. Take the mandible, and try to stretch onto the either directions. Because you know Parkinson's disease. What is a major problem here in Parkinson's disease? Rigidity. They will be fixed face. Muscles are very rigid. So what you want to do here? You want to do some stretching and all. Even the jaw muscles will be very fixed. So you want to take, then stretch to the either directions. So that definitely that patient will speak. If you are not doing that, he won't speak. Understood? Especially Parkinson's disease patients. These stretchings are very, very, very important. Understood?